Good afternoon. We're here with Humboldt County Health Officer Dr. Teresa Frankovich for the September 4th media availability. Thank you for being with us.
Thank you.
Would you like to start by addressing the community?
Sure. I did just want to mention the holiday is upon us, Labor Day weekend, and I know that that's, especially in a beautiful area like Humboldt, it's traditionally a big outdoor and a gathering time. I just want to emphasize to people that we're in a relatively good place right now, and the reason for that is that most of us have been doing a really good job at trying to, not gather, trying to distance and use facial coverings and all of that. And it's never more important than when we're having a lot more activity going on. So, the success for all of us going forward is contingent on all of us still doing our part. So I just like to ask people to be sensible and ideally, if you're going out to the beaches, if you're going to do something, do so with your household unit. If you are going to be with people who are not part of your household, the smaller the group, and I'm talking like 4 people, 6 people, not 20, not 30. The smaller the group, outdoors, using facial coverings and distancing is the safest way to do it for all of us. So, and that being said, I hope everyone has a safe holiday.
Thank you. The North Coast Journal asked, regarding the new testing partnership announced this morning, how quickly do you anticipate the new project will be able to turn around samples and report results?
Well, it's the really exciting thing about having this locally because we don't have to ship specimens out of the area, which generally adds at least another day onto the testing turnaround time. So we're anticipating a turnaround similar to our Humboldt County Public Health Lab of 24 to 72 hours, really. So I think it is a high throughput machine that will, with good organization and operation, should be able to do that for our community. So it will work equally well for people who are symptomatic and people who are not. And we're really looking forward to that.
The North Coast Journal asked, once the new project is up and running, how do you expect public health and local providers to triage samples between labs and determine where to send them?
Well, it's a really good question, and we are still working out the details on some of that. My sense is that providers will likely either have the option of referring their patients to be tested, because we will be setting up collection sites that are operational throughout the county, and also there may be an electronic opportunity for them to actually put in the order on their end, at least in some offices, and for that order to be seen at the other end and the specimen to be able to be routed that way. So we'll provide more details as we get closer and see what works. Also, I just want to point out that, when we start this, we're going to start with the basic underpinnings in place, and the process will evolve over time as we see what meets the need. I think the most important aspect is that we have excellent capacity with excellent turnaround time so that we can manage cases, because the real underpinning of our response, and in addition to the community participation in helping, the real underpinning of our success is the fact that we're able to both test symptomatic people and beyond with what we have currently in place, and that our contact tracing team is doing amazing work at reaching out to individuals, identifying cases quickly, getting people isolated and quarantined so we prevent as much spread as possible.
Thank you. The Times Standard asked, California Governor Gavin Newsom this last week signed into law a ban on flavored tobacco products, including flavored e-cigarettes and candy vapes. What is the science behind smoking as a comorbidity in COVID-19 cases, especially among young people, a target demographic for those tobacco industry products?
Well, first I'd like to say I'd like to congratulate Governor Newsom. I think that's an excellent public health move. We certainly know that children in particular, because of their developing brain and chemistry involved, become addicted more easily if they begin using nicotine products early in life. And it is the more we can delay that permanently would be great, the more helpful it is to prevent addiction. And so obviously these products that tend to really entice younger people in particular, it's important to have a ban on those to prevent the introduction of that product into their lives. In terms of COVID, what I would say is there just isn't a lot of really good data yet about smoking of any type and COVID. It certainly appears that if you are hospitalized with COVID, that it is more likely that you will have more severe disease. There's more risk of death likely if you are a smoker related to this, but there's not a lot of really case-controlled studies even on that yet, or on are you more likely to become infected, and if so, are you more likely to be hospitalized? So there's a lot we need to learn, and when you look at the young population who are less likely to get hospitalized overall, the data is even more scarce. So I think it is intuitive that we know chronic lung disease can predispose to more serious COVID disease. We know that tobacco use increases risk for chronic lung disease, and so it feels like it's not a big leap to me that smoking is going to increase your risk with COVID, but we just need to see the data as it plays out.
Thank you. The Times Standard asks, what percentage of individuals reached out to through contact tracing never respond? What is the process that happens if people who are potentially exposed to COVID-19 are not cooperative with contact tracers?
It's, I guess a testament to our contact tracers and investigators that it is rare to none that we don't reach someone. I mean, I actually checked in with my nurses recently about this, and people were having difficulty coming up with an instance where we had not been able to reach someone that we were trying to reach. They're pretty persistent about this and use all the tools that they have. So we are reaching the individuals that are identified. Now, it's another question whether all individuals are identified by the person involved, but we are, I think the fact that we're doing as well as we are suggests that we're getting most of the information needed. In terms of not cooperative with contact tracers, again, we haven't had to push that limit. We certainly, with people who are not cooperating with isolation or quarantine, have been able to bring law enforcement into the picture. And if we needed some assistance in finding someone, I'm sure we would do that as well. But so far, we've been very fortunate. People overall may not be thrilled about spending time on the phone with us, but in general, they've been cooperative.
Thank you. The North Coast News asks, many restaurants have reopened for dine-in in Humboldt. What is the guidance on business reopening?
So for restaurants, again, the guidance is that they can't reopen for indoor service at 50% capacity based on where we are in the governor's framework. There are a whole slew of other guidance points for indoor restaurant service, and those are available in the CDPH OSHA guidance that can be found on our JIC site. So restaurants that have received our certificate have gone through that planning process, developed a plan that we approved, and should be posting that at their restaurant, that they have gone through that process. And so we're hopeful that people will adhere to that. And certainly if there are concerns about whether any business entity is being compliant with safety measures, then we encourage people to contact the Joint Information Center so that we can follow up on it.
Thank you.
Thank you.
The North Coast News asks, with Labor Day weekend here, many areas of California are closing beaches, etc. If Humboldt remains open, how concerned are you about people gathering, and will there be consequences if they do?
Well, we tend to be a bit more fortunate here in the sense that because we're a rural area, even with some tourism, we tend not to be as compact on beaches as some areas of the state that are in urban areas. And so I'm, again, as I mentioned at the outset, really asking people to adhere to the recommendations. If you're outdoors, we need to be 6 feet apart from each other. If there are instances where you cannot be for some reason, it's incredibly important that you are using facial coverings, even if you're outdoors. And I want people to be respectful of each other and take care of their fellow Humboldt residents.
Thank you.
Thank you.
Thank you for being with us this afternoon.
Thanks.